My name is Valerie Grimsley, and I am the Program Director in Merida, Yucatan, Mexico. Me llamo Valerie Grimsley y soy la directora del programa de Merida, Yucatan, Mexico. We're starting a new program that really looks at health care in Mexico. And our reasons for doing it: first, the Latino community in the United States has just grown. So one of my philosophies is learn about healthcare, learn about the Latino population from south of the border. And then also why it's relevant is now many of the same diseases that we're seeing in the United States, we're seeing the same thing in Mexico. The growth of diabetes, the growth of behavior-related illnesses and diseases. So there's also a real practicality that you can come and study the same sorts of things, the same sorts of trends that are happening in the United States, to see them in Mexico, as well as learning the cultural differences, the language differences, and how health and culture are related. The way the Global Health Program will work on site is that it will be very individualized. Nursing, physical therapy, occupational therapy, patient-doctor relationship, nutrition, mental health is a part of it, if that would meet a student interest. And then we also will have a session with a traditional Mayan healer. So we'll be seeing the difference between modern medicine and traditional medicine that is still practiced in many families and in many parts of the Yucatan. I'm convinced that any student that is going into healthcare, education, social work, psychology, anything that has to do with human services, it's really important to learn about Mexico from the other side of the border. The reality is a teacher will have Latino students in his or her classroom. In the medical profession, you'll be dealing with Latino patients. Learn about the history and the culture and the grandeur and the socialness and the language from the other side of the border, and I think it will make a student a better professional in whatever profession that student decides to go into.